Sarah and John finally have furniture, hallelujah. But they still have a negative attitude towards children. So today, even though I know it's unconventional, I'm bringing in a therapist. And I know it's gonna be a wee bit of a surprise for them, but I'm really hoping they can be open to it because I really think there's deeper issues here.
Oh, hi, Rosie.
Hey, Rosie.
Welcome again, nice to see you.
Again. I brought a friend of mine here today.
Hi.
This is Dr. Ryan, this is Sarah and John.
Doctor.
Dr. Ryan, is it?
Yeah.
How do you do?
All right, nice to meet
Nice
you.
to meet you.
What kind of
Doctors,
doctor are you?
everything okay?
Yeah, doctors, everything's okay. It's a little bit of a surprise. I know you guys might be a little bit resistant to it, but I am feeling that you're still not really in touch with this baby and what's about to happen in your lives. And so I wanted to bring Dr. Ryan here because he's very good at mediating and helping me get you to understand where I'm coming from.
I'm sorry, I'm still a little bit confused as to what type of doctor you are.
I'm a clinical psychologist.
Wait, so you brought a therapist
Yep.
to my apartment because you think that I'm not prepared for my child?
Exactly. Took the
Okay.
words out of my mouth.
Are you kidding me? A therapist? Like, lady, do you think I'm crazy?
Wow. Well,
That's pretty,
kind of an indictment.
yeah, it is an indictment.
Coming up, excuses, and let me just tell you where I'm coming from. Like, it hasn't been baby-proof.
I'm not an ex-crackhead. I'm like 5 seconds away from kicking them both out of my apartment.
This is our first name.
Bode. Like
No,
Bode.
it's not a boat, it's Bodie.
It sounds like a girl.
I'm not sure I enjoy watching them butchering our name.
Wait, so you brought a therapist
Yep.
to my apartment because you think that I'm not prepared for my child?
Exactly.
That's pretty,
Kind of an indictment.
yeah, it is an indictment.
I'm sorry, but these two have whacked ideas when it comes to babies. They hate babies, but they're gonna have a baby.
But, we're game. We'll give him a shot. Why don't you come on in?
Okay, so what I've seen so far is you guys are such intelligent people, and you sort of use your intelligence to sort of hide the fact that you're putting off getting prepared. You always have a great answer for why something's not ready, but really at the heart of it, it's just not done and it's a real big issue.
Well, I mean, I don't think she's questioned at all your capacity to take care of the child, but seeing that you're not behaving in ways that people typically do for preparation, she didn't know how to make sense of it.
What's not done?
Whether it be the nursery or even just talking about the baby as a big part of your life. You sort of always discuss the fact that other people, their babies are the center of the universe, we don't want to turn out to be like that, we hate kids. There's a lot of negative things that you say about babies and children. And I just think there's a certain level of denial.
Honestly, I know you deal with pregnant women all the time. Do you know how hormonal I am? Like, back off. Is anybody really prepared? I'm not gonna like fake preparedness. I mean,
Excuses, and let me just tell you where I'm coming from. Like, I work, for example, for a charity where they take care of babies, and if they've been in the system for whatever reason, whether it's drugs or a baby's been taken away, the system comes around and checks the house is ready for a baby. Your house wouldn't pass. I'm serious. It hasn't been baby-proof.
I'm not an ex-crackhead. I'm totally capable of buying this stuff. I mean,
But when is my point? When are you gonna buy it?
I'm pretty enraged. We're not these horrible people. So I'm like 5 seconds away from kicking them both out of my apartment.
Let me just get a little sense from you. You know, you heard Rosie mention that some of the things aren't prepared. Sounds like there's some negative talk about maybe children in general. What's your sense of what she said? How do you feel about that? And does it make sense?
It doesn't make sense to me. I mean, there might not be children's decals on the wall yet, but I don't think newborns care about that.
I'm not super gushy, but that doesn't mean that I'm not capable of, you know, loving the baby or being excited about it.
So let me just, if I heard that correctly, to some extent what you guys are saying is we are prepared emotionally. Very loving, we think we're gonna be very competent, but maybe I'm not that emotionally expressive.
Well, no, I'm probably unprepared emotionally, but I don't really know that a therapy session or buying diapers is going to prepare me emotionally. That's the thing.
So let me ask this, do you feel anxious frequently?
All the time. I'm a really anxious person.
Do you like that?
No, I hate feeling anxious. I'm just not sure what to do about it.
My guess is that coping skills you've used in the past aren't as effective for this.
That's the thing, is that I'm anxious enough as it is. I just can't waste the anxiety calories on, you know, before the baby.
Is it possible, though, there's another strategy? Because the strategy you're talking about is called experiential avoidance, which is, I don't want to feel that anxious.
Right.
So instead, I won't think about it. Right?
Okay.
When he was addressing Sarah's anxiety, I was thinking, damn, like, he actually knows a lot about it. And I grapple with Sarah's anxiety all the damn time. And I get nowhere.
I do that a lot.
Yeah. See any problems with that strategy?
I guess, you know, deal with stuff.
By compartmentalizing and not dealing with it, you're not only just delaying it and holding it off, but you're not going to adequately be able to cope with the stresses when they come.
This guy actually sounds like he knows what he's talking about. And not only that, he seems to be really accurately diagnosing me from only having met me for like 5 minutes.
I hear you guys a lot talk about all the things that you have to give up all the time. And that's true. When you have a baby, there's like your life completely changes, and you do give up a lot of things, but you get a lot of things too. And it's that part of the discussion that I don't hear you guys talking about.
Yeah, I guess we haven't really talked about all the fun, exciting stuff we're gonna gain.
My guess is you guys aren't getting to really fully appreciate your freedom now because you're thinking it's about to have a funeral.
Yeah,
Right.
It has an expiration date.
And you're not getting to fully appreciate the excitement you might have about this baby that's coming. Maybe there's another way, which is to be willing to have both. The anxiety and the excitement.
That makes sense.
Good. Are you glad I brought Dr. Ryan?
I am. No, I really am.
I think Sarah and John are not callous and thoughtless. I think they're just scared. And that is completely normal. Parents are scared all the time, but that is a sign of bonding with your baby, and that is a sign of love. We made progress.
I feel like I have. I feel like I have. I was reluctant at first. I thought you were telling me I was crazy.
A little
And
bit.
then I needed a shrink. That's okay, I am a little.